Let's keep reactions to coronavirus in perspective. We Americans seem given to overreaction. The recent coronavirus is a perfect example of how some in our news media, bent on sensationalizing every crisis, can strike fear even into the hearts of supposedly stalwart Wall Street traders. At this writing, the Dow Jones has plunged nearly 4,000 points, close to 14% of its 29,000 high. Nasdaq and S&P are headed in the same direction. Television, home of the greatest of all news shows, constantly bombards us with the near-pandemic nature of coronavirus. Now, I am not trying to minimize the threat of the coronavirus. We should be concerned. The current coronavirus, the COVID-19, is one of about 5 distinct coronaviruses. Other strains of the coronavirus are common. According to the Centers for Disease Control (CDC), this virus spreads mainly from person to person between those in close contact, within about 6 feet, of each other. It spreads through respiratory droplets produced when an infected person coughs or sneezes, and these droplets then land in the mouths or noses of people who are nearby or are inhaled into the lungs. The CDC also contends that a person may be able to get COVID-19 by touching a surface or object that has the virus on it and then touching the mouth, nose, or possibly the eyes. However, the CDC does not believe this means of transmission is the main way the virus spreads. Just how easily the virus can spread from person to person varies. Some viruses, such as measles, are highly contagious, while others are less contagious. COVID-19 seems to spread most easily in places where people are crowded together, such as in China's Hubei province. Worldwide, at this writing 82,589 cases of coronavirus have been recorded. Of these cases, 2,814 have resulted in death. Of 33,345 closed cases, 92% of people recovered and 8% died. Of current unresolved cases, 37,959 are mild and 8,471 are serious. As of February 27, the United States has a total of 60 cases. 6 patients have experienced total recovery, no one has died, and not one case as of February 27 considered serious. Frankly, I am baffled at the uproar over coronavirus and the eerie silence that surrounds another illness that has impacted the United States much more profoundly: influenza. Contagion Live, a news resource specializing in infectious diseases, reported in its February 27, 2020 update that the United States has had 29 million cases of influenza. As of February 27, this outbreak has resulted in 280,000 hospitalizations and 16,000 deaths, in the United States. That last figure includes 105 influenza-associated deaths among children, according to the CDC's FluView. According to the World Health Organization, between 3 million and 5 million people suffer from influenza every year. The number of deaths each year ranges from 290,000 to 650,000. While I am not trying to minimize the threat of coronavirus, but influenza seems to be a greater and more prevalent health risk, especially to the people of this nation. Still, if we were to follow common-sense preventative measures, we would put ourselves in a better position to avoid any and all respiratory viruses. First, wash your hands early and often. If you are visiting a patient, wash your hands with soap and water or an alcohol-based rub before and after contact with the patient. Also, wash your hands after coming in contact with respiratory secretions or items potentially contaminated. Second, keep your hands off your face. Do you have any idea how many portals to your body exist on your face? Avoid touching your eyes, nose, and mouth with unwashed hands. Third, cover your mouth and nose when sneezing or coughing, and then wash your hands. Fourth, avoid close contact, kissing, sharing cups or eating utensils, with people who are exhibiting cold-like symptoms. Fifth, do not go to work or school or public places, and especially do not visit people in the hospital, if you are congested and ill yourself. Please keep your sick children out of daycare. Your sense of bravery or commitment may actually do little more than spread to others your illness or the illness of family members. Sixth, go to your doctor if symptoms persist. Keep things in perspective. At present, you are much more likely to get sick and die from influenza than you are from coronavirus. By taking sensible precautions, we can ward off these diseases and protect ourselves and others from exposure.